Greetings students, my name is Rodzana Khwali, a third-year student at the Department of Human Nutrition and Dietetics. Today I'll be sitting with our HOD, Mrs. Pim Kontwana, to ask and answer the questions that the prospective students have. So over to you, ma'am.
Hi, hello everyone. My name is Pumazam Kontwana. I'm the head of department at the Department of Human Nutrition and Dietetics at Nelson Mandela University.
So ma'am, can you please tell us what is dietetics about? Can you please also highlight the duration and where it's offered in the university?
Yes. So dietetics is a very old profession, especially in South Africa. The Dietetics and Nutrition Board was established in 1981 under the Health Professions Council of South Africa. So it is a fairly old profession, and it's a very growing profession owing to the current interest in health and wellness amongst the population. So it is one of those fields of study that are in demand globally. It is currently offered at this university at South Campus. That is where our main department is, but our students do travel to various campuses for various activities as well.
And how long does it take to complete?
It is a 4-year degree, starting, in the first year where students do their pure science modules, they do their physics, they do their chemistry, statistics, notes, and computer sciences mainly, and also an introduction to nutrition subjects, basic nutrition, food science, and food service management. And then they progress to the second year where it's also a combination of pure sciences, your microbiology, biochemistry, physiology, and nutrition and food science, food service. And then in third year, that is when they start to do more in terms of hospital and clinic dietetics, or hospital dietetics, which we call therapeutic nutrition, and also community nutrition, where they also do community work and work at the clinic, and start also to do their research programs.
Okay, so let's look at the career opportunities that it has. You mentioned that it is recognized globally. So which career path can the students pursue after completing the program?
All right, we have a lot of career paths that our students can follow. Firstly, we have what we call the stream of the food service and food science. And we know that there's a lot of interest in food safety in terms of our health, and we also know that in the food service management area, there's a lot of interest in what people are eating. If you go nowadays to restaurants, you'll see that the menus have got information on the nutrition, the nutrients, the calories, etc. So there's a lot of scope for dietitians to work in that field to develop those healthy menus that the consumers are demanding. So that's a first leg that the students can follow. And also they can manage catering as well as other food service in the private sector and in the public sector. And then there's also a lot of scope for dietitians to work in hospitals, because we know that because of our disease and our, I would call it the epidemiologic transition, there are lots of diet-related diseases that require nutrition interventions. So our students can work in those areas where they can work either for the public hospitals, for the government hospitals, or they can join the private sector and start to consult patients who are in the hospitals. We also know that we have a demographic transition where we've got an aging population, where we know that some of the institutions that cater for the elderly also do catering. So we have that community work that dietitians can work in, working in there, and also in the early childhood development centers. So that is what we usually call our community stream. So we tend to focus on 4 streams, the first one being the food service, then the community, the therapy, as well as the research stream, because as we said that it's a fast growing profession. There's a lot of work, there's new information on a daily basis. I would even dare say try to say an hourly basis because there's always something new that links food, nutrition, and health and wellness. So those are the 4 streams that people can work in after completing their degree.
Okay, so earlier you touched a bit on what is been done on each level. So
Yes.
overall, I'm trying to establish the structure of dietetics,
Yes.
looking at the theory, the practical, the work
Yes.
integrated. How do you
Yes.
ensure that all of
Yes.
that is incorporated into the program and it's well balanced?
Yes.
So yeah.
So I spoke about the first 3 years, which is where they do a bit of pure science and introduction to nutrition, follow again with science and nutrition, and start to get introduced to the full dietetics modules now, which is a community and therapeutic modules, and continuing with food service and research in the 3rd year. Now in the 4th year, that is when quite a lot of work integrated learning happens. It does get introduced earlier over the years from 1st, 2nd, 3rd year, but in the 4th year, that is also what we call an internship year, where the students are fully placed in different sites and different facilities. One of the blocks will be for food service, focusing on that food service stream, and where the students will be placed at a catering or a hospital, a food service management unit or kitchen. And then the second one would be the therapeutic stream, where the dietitians are placed in a hospital ward and they have to manage patients that are admitted in those hospitals. And the third one also, again, fully at a community facility or community health center, where within that center they also go out and work in the early childhood development centers, they work in the old age homes, they work in the schools, and they work generally in that community. And then fourthly, then that again, their research has to be impactful. So most of their research is also out in the field. Quite a lot of our students do research that is hands-on, and that is mostly our fully work integrated learning block or year. But the other 3 years, they also do a lot of practicum. So you'd find that there is a certain percentage of the therapy, food service, and community modules in the 3rd year, where the students have to every week, in fact, they have to go and do work outside or work integrated learning. And in the first 2 years, it's usually maybe once a term where they also start to get introduced to these levels. So there's quite a lot of work integrated learning involved, especially towards the last 2 years of the program. Yeah.
I think one of the most important questions that we need to highlight is the admission criteria, how to get enrolled into the course. So can you please highlight APS points and also which subjects are very important to follow this career path?
Yes, okay. So because of of the pure science modules, yes, in the first 2 years, we do require that in addition to the languages that the students may have taken, as well as life orientation, they have physics and pure mathematics. So those are the 2 main subjects that we need to have, because then the students will have to use those mathematics and physics skills when they're doing the first year physics and the first year chemistry, and also the second year microbiology and biochemistry. So that is the 2 main science subjects that we need. In terms of the scores, in the old system, we used to use the APS score, which is a score of 38, but the applicant score that the university is currently using, we require the students to have a minimum of 390 points to be able to enter into our program.
Okay, so ma'am, most learners, because of this, a certain knowledge that is not open to the public or everyone can access. So they think that in the Faculty of Health Sciences, the only doctors are medical doctors. So can you please highlight the postgrad of dietetics and how it starts and up to which level it ends?
Yes, that's very important, Rosani. After completing the degree, students have to go and do their community service here. It is part of the national requirements currently that they complete the community service here. And after they finish the community service here, the students then register as independent practitioners. And we do encourage students to not only stop learning after the 4 years, because I mentioned that this is a growing profession. It's a very dynamic field of study. New information comes every day. So lifelong learning becomes a crucial part of the dietitian's work. So we also then have postgraduate programs in our department. We've got a master's program, we've got doctoral programs as well. So we do invite students, and we do find that our former students come back and do their masters with us, and also complete their doctoral degrees, the PhDs, with our department, and that is something that we encourage a lot amongst the students. There's a lot of concern and a lot of debates about the current nutrition situation in the country. The fact that there's a lot of food insecurity as well as a high food waste. So we do need dietitians to advocate and to speak about good nutrition to the general population. Unfortunately, the numbers of dietitians are not enough to cover our current population. If you look at the recommended norms, we need one dietitian for every 10,000 people in our population. And currently, our database at the Health Professions Council's Dietetics and Nutrition Board is sitting just over 4,000 dietitians. So we do need to train more dietitians to ensure that we address all these nutrition challenges that the country faces, and not only our country, but these challenges are global nutrition problems.
Okay, so from now I'll be talking about my experience. In my first year, I asked myself, am I good enough? Am I smart enough for this course? But fortunately, the university and the department had structures that ensured that I overcome my anxiety. One of the main structures that we have here at the university is peer mentors, where we have weekly sessions with our mentors to check on their progress, and also the help of our lecturers. They encourage us to come forward when we encountered problems, whether academically or personally. So for me, that made me feel like I'm at home. So see you next year, guys. Thank you.